Good day, everyone. Welcome to our first video series. This will discuss uncertainty in the orthopedic field. Because in medical healthcare, we are science, okay? The science is very directed based on logicality. So we follow a specific model for orthopedic practice that goes in a specific direction, while evidence comes by starts to modify this model. Because of that, and because again I'm talking about my personal experience, we're gonna find some illogicality, okay? So the first part of the series is about illogicality. What I'm discussing about illogicality is personal questions that I had when I was a student. During the orthopedic course in my undergraduate study, we were studying spondylosis. So the professor saying spondylosis is a degeneration of the intervertebral disc and so on. And we're going to treat it with, of course, there is medication and there is physical therapy, and patient will recover and come better. So I asked a very logical question. Physical therapy, either electrotherapy or exercise, or manual therapy, does that cause a regeneration of the degenerated structure? So we answered no. And the most logical question comes in mind. If physical therapy does not improve degeneration or cause regeneration, and patient pain is reduced or completely disappear, so are we really treating degeneration or spondylosis, or are we affecting something else? The same question came in mind again when we were studying knee osteoarthritis. Physical therapy does not cause regeneration. How does it decrease pain? Again, in my internship, when I started to come in contact with patients, I would find patients with spondylosis describe a history of remission and relapse. So they are pained at some time, then spontaneously they recover, there is no pain, then they have pain again. Again, that doesn't make any sense. Does degeneration comes and goes as it's causing the pain? No, it doesn't. Degeneration does not come and go. So the illogicality became very apparent to me. Now, after years and years, I know the answer. Most clinicians know the answer to this point, but not everyone does. What we're going to do in this series is to discuss this illogicality. To start, we have to examine more the orthopedic model. The orthopedic model consists of mainly 5 parts. First part is the interview, the questioning, history-taking part. Second part is the examination. And we move from the examination to a specific type of testing, right? Radiology or lab investigations that's primarily act to modify the suspicion that came from examination by confirming or denying it. After doing the first 3 parts of questioning or interviewing, examination, and radiology and lab investigations, and diagnosis and prognosis is a 4th circle. At this point, the collected information provide diagnosis and prognosis. And based on this 4 steps, we will come with the 5th step, which is treatment. Okay, we're gonna go in depth specifically on the part of examination and radiology that produces the follow-up conclusions of diagnosis and treatment. And we're gonna go through it through new evidence. So in this series, we're going to start step by step through a journey from the first questions or statement of the series about uncertainty and illogicality to the conclusion of how orthopedic practice is being changing at the moment. Because currently we're going through an era of orthopedic diagnosis and management major change. Okay, so in our next video, we're going to discuss examination more in depth. See you soon.